Hello, my name is Femi and welcome to day 4 of our Sickle Cell Awareness Month Challenge. Today we'll be considering pain crisis in sickle cell disease. And one may ask, what are the pain crises in sickle cell disease? We have talked about a lot. We have introduced the topic sickle cell, and from the introduction I talk about the sickle cell being a C-shaped cell found in the red blood cell. Instead of being disc shape, it tends to take the shape of a crescent, which is the half moon, or a sickle or C shape, whatever you want to call it. So with this, it tends to clump together when it passes through the blood vessel, leading to low oxygen supply and the rest. So these are some of the building blocks to the pain crisis that we'll be discussing today. So pain crises are one of the most common and severe features of sickle cell disease. These episodes of this pain are sudden, unpredictable, and extremely painful. It doesn't announce itself when it comes. So these pain crises are caused by this sickle cell blocking blood flow, which lead to tissue and organ pain, and in some points it can cause even organ damage, because when it block it reduce the level of oxygen supply to that particular organ or tissue, thereby leading to necrosis. So pain may last hours to days, and the severity of this pain varies from mild to excruciating pain, depending. So as you can see, this is just an animation trying to point out that how these crescent shaped red blood cell tend to block the normal flow of blood in tiny blood vessels, thus leading to this excruciating pain. So what are the common triggers to this sickle cell crisis? And here we have dehydration. So somebody may be wondering, how does dehydration trigger crisis? So when the body is dehydrated, the blood volume decreases and it becomes more concentrated. So this makes the red blood cell more likely to stick together and block blood vessels. So sickle cell cells, uh, which are already stiff and sticky, clump faster in low fluid condition, leading to vascular occlusion, or what we call the blockage of blood vessels. That is why patients are always encouraged to drink water to prevent this crisis. And number two, stress. So how does stress trigger sickle cell crisis? Stress causes the body to release hormones that we call the adrenaline and the cortisol hormone, which are cause constriction in blood vessels. So when there's constriction in blood vessels, it reduces the flow of blood and thus cause the clumping of these crescent shaped um, blood cells, uh, getting stuck and blocking normal blood flow. So stress also arises from metabolic demand when more oxygen is needed, which the sickle cell cannot supply efficiently, and therefore worsening the problem, the condition of the person living with the disease. So how can one work off this stress, which can trigger this sickle cell disease? By having to relax himself, relaxation, going for counseling, stress management technique such as yoga or meditation can really help to calm the release of this adrenaline and cortisol hormone that cause the constriction of the blood vessels. So the next one is cold temperature. Yes, this is very important. So cool weather causes blood vessels to constrict, which we call in medical term vasoconstriction, to preserve the body internal heat. So this narrowing of the blood vessels now make it easy for the sickled cells to block the vessels. So low temperature also reduces oxygen delivery, which promotes more of the sickling of the red blood cells. So patients are always advised to stay warm. For people who are living with sickle cell anemia and people taking care of them, please, our advice, if you can, when you notice a change in the weather, if you can get a thick clothing to wear so as to avoid sodium exposure to cold. So, infection. Infection increase the body oxygen demand because the body uh, soldiers, which we call them the white blood cells, are trying to ward off this infection. So oftentimes these are caused by fever and inflammations. So sickle cell patients are already prone to infection because their spleen is already damaged. If you remember from our video yesterday, I talked about the spleen having a function of helping the body defense mechanism. So during infection, this sickle cell break down faster, worsening the anemia and increasing sickling. So this inflammation also causes the blood vessels to swell, adding to the blockage of the blood vessel. So how can we boost the immune system of someone living with sickle cell anemia? Is by vaccination and prompt treatment of infection. If you are living with sickle cell anemia and you feel sick, please don't feel shy to tell people about your pain. Always go for medical help. And also, they can be given antibiotics, which are critical for sickle cell patient health. So, how does this picture even come about? Talking about what triggers sickle cell anemia. This is a picture representing people that are on a hike, and when you go hiking at high altitude, the air contains lesser oxygen. So what happens? Your sickle cells, your sickle cells, which are not like that of a healthy person, which is circular in shape, yours is kind of a C in shape. These sickle cells are low in oxygen. So what happens to them? Sickle cell then clog in these blood vessels because they can no longer supply you with enough oxygen. What they do is they tend to die faster, and the body doesn't have enough ability to be able to produce more of it. This is why flying or going on hiking on unpressurized aircraft, or even finding yourself in a very stuffy bus or an environment. So patients are advised to avoid high altitude and maintain good oxygen condition. Always stay in a ventilated place where the oxygen supply can be okay for your body to function. So this is just a picture representing what happens when your body is at high altitude or in a place where there's low oxygen. So what are the areas of the body affected by this pain crisis? We have the bones and the joints, where we have the sickle cell patient complaining of joint pain, and almost every part of their joint is aching because of the cells clumping together and gathering in particular joints. So chest pain is one of the um, things people with sickle cell anemia experiences, which is due to the clumping of the blood cells. We have abdominal pain, the limb pain. And why does this even matter in the first place? Pain crises are often misunderstood, as in our African setting. I stated it in our second episode. Some people take it to see me and an Ogbanji, something when somebody is complaining of pain. Some people may not really understand and tend to laugh at it. When you see somebody in pain, don't laugh, seek for help. If you can help, get him to hospital very fast, or you can call an ambulance. So it's not just an ordinary pain, and it requires immediate medical attention. As I said earlier, seek medical attention, and it can even lead to hospital admission. So this crisis always impact daily life and mental health of sickle cell anemia patients. So always stand up for people living with sickle cell anemia. Always be there for them. If you have a friend or loved one, always be there to them, with them. Don't always see them as weaklings. No, they are also as strong as you are. As I always say, they are warriors. So one of the key takeaways where I want us to take away from this series today is that pain crises are often the central part of living with sickle cell disease, and understanding this help build compassion among both health workers and even family, friends, people living together with people living with sickle cell anemia. So awareness saves life. It's very important for us to create this awareness so that we can be able to stand up to help people who are living with sickle cell anemia, stand together with them even in a time of distress. Join us tomorrow again as we discuss more on our 26 days challenge of sickle cell anemia. I'm your host. totally okay.